Hey there, and welcome to The Explainer. Today, we're diving into a silent threat that might literally be hiding right in plain sight, inside our own bodies. We're talking about those two tireless workhorses that constantly filter our blood, regulate our blood pressure, and balance vital chemicals, all without ever asking for a simple thank you. Yep, I'm talking about your kidneys. And the reason we really need to tackle this today is because when these vital organs start to fail, they rarely sound the alarm until the damage is already severe. To really grasp the scale of this, just take a look at this staggering number. According to the National Kidney Foundation, an estimated 35.5 million adults in the United States are currently living with chronic kidney disease. 35.5 million. That is a massive chunk of the population facing a highly destructive, yet honestly mostly invisible health crisis. But wait, here is the absolute most shocking part of this whole medical mystery. 90% of those 35.5 million people, they have absolutely no idea they even have the disease. Seriously, no clue. It's basically the ultimate iceberg scenario. All this damage is happening deep beneath the surface, completely unnoticed.
So here is our roadmap for today's anatomical tour. We're going to cover the silent kidney crisis, bathroom habits, skin and extremities, internal fatigue, gender nuances, and finally, testing and protection.
Let's just jump right into part one, the silent kidney crisis. You see, our kidneys are incredibly resilient filters, which ironically is kind of part of the problem. They'll just keep working, adapting, and filtering your blood, even as they take on heavy damage. They never complain until they're right on the brink of complete exhaustion. Dr. Joseph Vassalotti from the National Kidney Foundation hits the nail on the head here. He points out that while physical signs do exist, people usually just brush them off or blame them on other minor conditions. So the symptoms we're about to explore, they're really just the tip of the iceberg. If you're actually noticing these signs, it usually means your kidneys are already really struggling to keep up with their daily workload.
Moving on to part two, bathroom habits and urinary changes.
Okay, since the kidneys are basically in charge of creating urine to flush out waste, it makes total sense that the absolute earliest physical clues of failing filters are going to show up right here in the bathroom. You really need to be on the lookout for a few specific changes. First up is increased frequency, especially at night. Doctors call this nocturia. When those kidney filters get damaged, it creates this abnormal, constant urge to go. On the flip side, though, as the disease gets to later stages, you might actually notice a sudden drop in urine output because the kidneys are just failing to process fluids altogether. And absolutely watch for blood in the urine. Healthy kidneys keep your blood cells safely inside your body where they belong. So if blood is leaking out, that's a massive red flag for filter damage. Now, there is a fascinating and honestly pretty surprising explanation behind foamy urine. If you're seeing excessive bubbles in the bowl, like the kind you have to flush 2 or 3 times to get rid of, that means protein is leaking. And here's a wild fact for you. That foam looks exactly like the foam you see when you're whisking up scrambled eggs. Why? Because the protein leaking from your damaged kidneys is albumin, which happens to be the exact same protein found in chicken eggs. It's a super specific visual clue.
All right, part three, skin, swelling, and cramps.
We're pivoting sharply here to look at how this internal failure actually shows up on the outside of our bodies. When your kidneys can't remove that excess fluid and balance your minerals, the evidence literally pushes outward. You might start noticing persistent puffiness around your eyes, or maybe swelling, which is known as edema, in your feet, ankles, and hands. This is all happening because failing kidneys cause your body to heavily retain sodium and fluid. You might also get hit with severe muscle cramps, especially in your legs, thanks to low calcium levels and poorly controlled phosphorus. Oh, and definitely check your fingernails. Advanced kidney disease can cause what's known as half-and-half nails, where the top half of your nail turns white and the bottom stays a normal reddish-brown. Wild, right?
But here is a super relatable question for a lot of folks. Why does your skin itch so intensely? So many people just brush this off. They think, oh, it's just dry winter skin, or maybe a mild allergy. But with kidney disease, this itch is deeply frustrating, and you usually can't get rid of it just by scratching. The medical term for this intense itching is pruritus. You see, healthy kidneys act like a precise management system for the minerals in your blood. When they fail, toxins and extra phosphorus just build up in your bloodstream. Combine that toxic waste buildup with shrinking sweat glands that cause severely dry skin, and you get this intense, crawling, prickling itch. It honestly feels like it's radiating from deep inside your body. It's actually a massive warning sign of underlying mineral and bone disease.
Let's head deeper inside for section 4, fatigue, nausea, and brain fog. Think about it. When your body essentially becomes a toxic environment because the internal garbage disposal system is broken, the systemic impacts are going to be severe. We aren't just talking about needing an extra cup of coffee here. We're talking about extreme exhaustion and a complete inability to concentrate. Plus, the buildup of toxins floating around in your blood actually travels up to your brain and triggers its specific vomiting center. That leads to severe nausea and a sudden total loss of appetite. And those same toxins, they make it physically difficult for your brain to shut down and sleep, which is exactly why sleep apnea and insomnia are incredibly common in chronic kidney disease patients. To really understand that extreme fatigue, we've got to talk a little biology. Healthy kidneys produce a hormone called erythropoietin, or EPO for short. EPO is basically the signal caller that tells your body to manufacture more red blood cells, and those cells are what carry oxygen to your brain and muscles. When your kidneys get damaged, EPO production just drops off a cliff. This causes anemia. Your brain and your muscles are quite literally being starved of oxygen, which makes it feel basically impossible to concentrate on even the simplest daily tasks.
Section 5. Gender nuances and risk factors. Let's look at how this hides. The gender nuances with this disease are absolutely fascinating. Early kidney failure can wear a really clever disguise, mimicking entirely different anatomical issues depending on if you're a man or a woman. For women, underlying kidney issues might be totally masked by an increase in urinary tract infections, unusual menstrual changes, or even severe swelling during pregnancy, which a lot of people might just assume is preeclampsia. For men, the urinary symptoms, like a weak stream or having to get up constantly at night, can easily be written off as an enlarged prostate. Decreased kidney performance can also restrict blood flow and alter hormones, which leads to erectile dysfunction. Because of these anatomical differences, the true culprit of early kidney failure often just hides in the shadows.
So who are the prime suspects actually causing all this damage? Well, if you're over 60, have a family history, or take a lot of over-the-counter painkillers like ibuprofen, you're definitely at a higher risk. But the two biggest culprits by far, diabetes and high blood pressure. High blood sugar basically shreds the tiny blood vessels inside the kidneys. And high blood pressure, that is a dangerous cyclical trap. The high pressure damages the kidneys' filters, and then in turn, those damaged kidneys cause your body to retain fluid, which just drives your blood pressure even higher. It is a vicious cycle.
Finally, Section 6. Testing and protecting your kidneys. Let's talk solutions.
The really good news here is that you don't need to panic. The medical community has already mapped out a fantastic solution. The Katie Geigo 2024 Clinical Practice Guideline is this globally established, highly rigorous medical framework. Physicians use it to properly evaluate kidney risks across a patient's entire lifespan, literally from childhood right on through to older adulthood. The path is already clear for us. You just have to step into the framework.
The most crucial thing is just getting tested, and it only requires 2 super simple steps. First is the EGFR blood test, which basically estimates exactly how well your kidneys are functioning and filtering out waste. The second is the UACR urine test. Remember that sneaky albumin protein we talked about earlier with the foamy urine? This test looks for that. If protein is leaking, the UACR catches it way before you'd ever see foam in the toilet. These 2 tests are absolute lifesavers because they catch the disease before the permanent damage sets in. And that brings us to your empowering action plan. Step 1. If you have any of those risk factors we talked about, demand an annual EGFR and UACR test from your doctor. Step 2. Aggressively manage your blood pressure and your blood sugar. Step 3. Adopt a heart-healthy, low-sodium diet to just take the pressure off those kidney filters. And Step 4. Stay properly hydrated. And please, stop smoking. Smoking severely restricts the exact blood vessels your kidneys absolutely rely on to survive. As we wrap up this explainer, I really want you to think about this. Your kidneys are working silently for you right at this very second. Based on everything we've uncovered today, what subtle clues might your body be trying to tell you? Don't wait for the silent threat to finally speak up. Take charge, get tested, and protect your health. Thanks so much for joining me on The Explainer.